Are you transitioning to Medicare, but you find yourself being stressed about facing potential lifetime Medicare penalties if you make a mistake? Well, in today's video, we will explain the potential Medicare penalties that exist. More importantly, we will talk about how to avoid them and what to do if you do end up experiencing a Medicare penalty. At our independent Medicare-focused insurance agency called Giardini Medicare, we specialize in helping people smoothly transition to Medicare. So if you do watch this video, you should have no issue at all avoiding any of the lifetime Medicare penalties we will talk about. Overall, there are 3 possible penalties when it comes to Medicare. These include Part A, Part B, and Part D penalties. Now, it might seem overly complicated and overwhelming, but remember, each penalty is tied to a specific part of Medicare, and knowing what penalties there are and when they apply is most the battle. And we really cannot stress this enough, but it is so important to educate yourself before you even begin Medicare, since these penalties are much easier to avoid than they are to undo. Let's get into the specifics about the different Medicare penalties, starting with the Part A penalty. Part A of Medicare, it makes up half of original Medicare, which consists of both Part A and Part B. Now, Part A is considered hospital insurance, and it covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care, just to name a few things. Now, luckily, the Part A penalty is extremely rare, but it is still good to understand it. One unique thing to remember about the Part A penalty is that unlike the other 2 penalties we will discuss, it is not a lifetime penalty. Now, the reason this penalty is uncommon is because it can only apply to individuals that have to pay a premium for Medicare Part A. But according to Medicare, 99% of Medicare beneficiaries do not pay a Part A premium, and therefore they don't experience the Part A penalty. Now, according to Medicare.gov, if you do have to pay a Part A premium and you do not sign up when you're first eligible for Medicare without having proper employer coverage or access to a special enrollment period, your monthly Part A premium, it might go up 10% when you do eventually need to enroll in it. You'll have to pay the higher premium for twice the number of years that you did not properly sign up. So for example, if you were eligible for 2 years for premium Part A, but you did not enroll when you should have, you would have to pay the penalty and the higher monthly premium for Part A for 4 years. The penalty can add up quickly in this case, making it crucial to enroll when you are first eligible if you don't have other coverage to properly delay premium Part A of Medicare. Now, as for the premium rates and the penalty amounts, in 2024, the Part A premium is either $505 per month if you paid Medicare taxes while working less than 30 quarters, or it could be $278 per month if you paid Medicare taxes while working between 30 and 39 quarters. So for 2024, the Part A penalty, it's either 10% of $278 per month or $506 per month. And again, this lasts for twice the number of years that you should have but did not sign up for Part A in this case. You can see an example of the penalty amounts here on the screen. Also, keep in mind that Part A premiums, they generally change from year to year, and therefore the penalty amount does as well. So how can you avoid the Part A penalty? It is not as daunting as it sounds. First off, the easiest and most obvious way to avoid the Part A penalty is by qualifying for premium-free Part A. And how do you do that? Well, you can achieve this by working at least 40 quarters and paying Medicare taxes through FICA taxes and payroll taxes while working. If you want to verify that you qualify for premium-free Part A, you can do this by logging online at ssa.gov into your personal account to find out exactly how many work credits you have accumulated, just like you can see here with the example on the screen. Now, if you did not personally work and pay Medicare taxes for enough quarters to qualify using your own work record, you may still be able to qualify for premium-free Part A through a spouse's work history. Now, just know with the spouse whose work history is being used, they must be eligible for Social Security benefits through either retirement at age 62 or disability benefits, although they do not actually have to collect Social Security benefits at the time you're using their record. Also, it's important to note that you must have been married at least 1 year before qualifying for premium-free Part A based on their work history. Now, a quick note, if you do not have enough work credits and you were a government employee, make sure to reach out to Social Security and ask them about Medicare qualified government employment credits and just see if those apply to you. If you don't have any method of getting the appropriate number of work credits for premium-free Part A, you may also avoid the Part A penalty if you delay Medicare enrollment due to having active employer health coverage through yourself or a spouse. And this gives you access to a special enrollment period. But what happens if you end up with a Part A penalty? Well, is there a way out? There is. You can try to apply and see if you qualify for a Medicare savings program, and this has your state's Medicaid program help cover your Medicare Part A premium while eliminating your Part A penalty. Your ability to qualify for this program, it will depend on your income and asset levels, and not all states' programs will actually cover Part A. So we won't go into too much detail right now, but we will link below in the description more information about these options. Other than that, you will likely have to pay the Part A penalty until you either accrue enough work credits to qualify for premium-free Part A, or you would have to pay the penalty until you are no longer required to do so. Now, please do not forget to like this video and comment below for any future topics you want us to cover before we move on to the Part B penalty. Thanks for doing that. And now that you have done that, Part B is the other half of Original Medicare, and it provides medical coverage for preventive services and medically necessary doctor services, outpatient care, durable medical equipment, mental health services, and other medical services. Understanding the Part B penalty is important as it could potentially affect your finances for a long time, as unlike the Part A penalty we just talked about, the Part B penalty, it lasts as long as you're enrolled in Part B. So basically for as long as you have Medicare, which is why it is considered a lifetime penalty. Also, the Part B penalty, it is much more common than the Part A penalty, although generally speaking, it is still thankfully uncommon. However, the Congressional Research Service, they reported in 2021 that 1.3% of Part B enrollees, which is about 779,400 people, actually ended up paying a Part B penalty during that year. Medicare.gov, they explain that if you didn't enroll in Part B when you were first eligible and you don't have access to a Medicare Part B special enrollment period, normally due to leaving active employer coverage, your monthly premium for Part B, it might go up 10% for each 12-month period you could have had Part B but did not sign up. But what does this actually mean in real life? Let's use Mr. Smith as an example. So Mr. Smith turned 65 on September 10th, 2021. This means his initial enrollment period to enroll in Medicare Part B ended 3 months after the month he turned 65. This means in his case, it ended at the end of December 2021. Now, in this case, Mr. Smith did not have active employer coverage, and he had to enroll in the Medicare Part B general enrollment period in March of 2024. And in this case, his Part B first became effective April 1st of 2024. In this case, Mr. Smith would almost certainly face a lifetime Medicare Part B penalty. So to calculate his penalty amount, we can first count how many months Mr. Smith did not have Part B while he should have after his initial enrollment period ended. This would consist of all of the months of 2022, all the months of 2023, and then 3 months of 2024 before his Part B became effective. This would be a total of 27 uncovered months. Now remember, the Part B penalty, it is not based on each uncovered month, but instead the number of 12-month periods he goes without proper Part B coverage. So although he was uncovered for 27 months, this is only 2 periods. So in his case, the penalty amount, it would then be 10% for each uncovered 12-month period, or it would be 20% for him. In 2024, this 20% penalty would be multiplied by the base Medicare Part B premium of $174.70 per month. So in this case, that would be 20% of $174.70, which equals $34.94. Now this is then rounded to the nearest 10 cents, which gives you a final penalty amount of $34.90 per month, which would then be added to the $174.70 per month premium for Part B. This results in him having a total Part B monthly premium, which includes the penalty, of $209.60 per month. That same congressional research report from before, it stated that on average, those receiving a Medicare Part B penalty have premiums that are 27% higher than if they were not subject to a Part B penalty. And just a very quick note, if you are assessed an income-related monthly adjustment amount, which is called IRMA, due to having higher income, and you happen to receive a Part B penalty, it is still based on the standard Part B premium of $174.70 per month, and it is not based on your elevated premium due to IRMA. Also, keep in mind that because Part B premiums, they typically change every year, the Part B penalty will also fluctuate since it is a percentage of whatever the Part B base premium is for the current year. All right, now you're familiar with how the Part B penalty is assessed. Let's shift gears and talk about how to prevent and possibly appeal the Part B penalty if necessary. So the most effective way to avoid the Part B penalty, it is by enrolling in Part B during your initial enrollment period, known as your IEP. And this is if you do not have proper active employer coverage to delay Medicare past age 65. Your IEP, it begins 3 months before the month you turn 65. It includes your 65th birthday month, and then it ends 3 months following the month you turn 65. And because there always has to be some wrinkle to the rules, if you were born on the first day of the month, your IEP actually begins 1 month earlier. However, if you're still working and you have group health coverage from your current employment or from a spouse's current employment, it is possible that you can delay Medicare Part B enrollment without facing this lifetime penalty, and you can decide to enroll in Part B later on. Just know in most cases, you won't want to delay Medicare past age 65 due to having active employer coverage unless the employer providing the coverage has 20 or more employees. And we talk about that in other videos as well. So if you do delay Medicare due to proper active employer coverage, then you do go to enroll in Part B after age 65, you will likely have access to the Medicare Part B Special Enrollment Period, which can be used while you are still covered by your active employer coverage, or it ends 8 months after your employment ends, or your employer provided medical coverage ends, and that is whatever comes first. If you are eligible for the Part B Special Enrollment Period for leaving active employer coverage, you should not be subject to the Part B penalty, and that is a very common scenario for many of our clients, so do not worry if that applies to you. Additionally, here is a list of new Part B special enrollment periods that were established in 2023, which, if you are eligible for, they might also allow you to enroll in Part B coverage after age 65 without a lifetime Part B penalty. Since we cannot cover every single scenario in this video, generally speaking, the Part B penalty, it occurs for individuals that have to enroll using the Part B general enrollment period, which runs from January through March of every single year. Okay, so what if you weren't able to watch this video until it was already too late and you are being assessed a Part B penalty? First, I know it's hard to say, but try not to panic.
Don't panic.
Here are some options you might have. You can request an appeal of the penalty decision with Social Security. According to Social Security, there is no deadline to make this request. The most likely scenario for this appeal would be if you can show that you had active employer group health coverage during some or all of the time period that is being used to calculate your Part B penalty. So for example, if you are being assessed 4 years worth of a Part B penalty, but you can show you had active employer coverage even just one of those years, it can certainly be worth appealing for the slightly lower penalty amount. You will have to submit your evidence of active employer coverage to Social Security in order to do this. Another option is that you might be able to request what is called equitable relief. Now, this is available only in unique situations where you can show that your Part B enrollment was done incorrectly due to the error, misrepresentation, or inaction of a federal government employee. This is not that common to use and is not always that easy to prove, but it might be worth a shot if it does actually apply to you. Another scenario for Part B removal is if you are eligible for Medicare before age 65. So if you're first enrolled in Medicare before age 65, usually due to disability, and you are being assessed a Part B penalty, this penalty, it gets eliminated when you turn 65, essentially giving you a fresh start.
Fresh start, clean slate.
And last but not least, if all else fails and you are assessed a Part B penalty, just like with Part A, you can see if you qualify for the Medicare Savings Program to have your state's Medicaid program help cover your Part B premium while eliminating the penalty. Again, this is heavily dependent on your income and resources, but it is certainly worth looking into. Just keep in mind that although it is likely always worth filing an appeal to eliminate or lower a lifetime penalty, simply not being aware of the proper Part B enrollment, it's not going to be sufficient reason for a successful appeal. But luckily, this penalty will not catch you off guard now that you've seen this video. If you have made it to this point in the video, please do not forget to subscribe to our channel and leave us a comment below for topics you want us to cover next. But now moving on from Part A and Part B penalties, let's look at the Medicare Part D penalty. That's Part D as in dog. Medicare Part D coverage is not part of original Medicare, and instead it refers to the prescription drug coverage that you purchase through either a standalone Part D plan or through a Medicare Advantage plan that includes prescription drug coverage. This is important to remember since although we often refer to this as the Part D penalty, it does also apply to Medicare Advantage plans with prescription drug coverage. The Part D penalty, it's likely the most common Medicare penalty since according to the Medicare Payment Advisory Commission, in 2022, about 5% of Part D enrollees paid the Part D late enrollment penalty. For understanding the Part D penalty, Medicare.gov, it states a person enrolled in a Medicare prescription plan, they may owe a late enrollment penalty if they go without Part D or other creditable prescription drug coverage for any continuous period of 63 days or more after the end of their initial enrollment period for Part D coverage. Don't worry, we will break that down and explain creditable drug coverage very shortly. As we mentioned earlier, the initial enrollment period, often shortened to IEP, it is the 7-month period that consists of 3 months before the month you turn 65, the month you turn 65, and 3 months following the month you turn 65. Now let's talk about everyone's favorite part, the math behind the Part D penalty.
Math.
The Part D penalty is calculated by multiplying 1% of the national base beneficiary premium. You don't have to remember that exact term, but we'll talk about what it means. That premium, or that base beneficiary premium, is $34.70 per month in 2024. You take that number times the number of full uncovered months you did not have Part D coverage or creditable coverage after your IEP. This amount is then rounded to the nearest 10 cents and added to your monthly Part D premium as a lifetime penalty. Now, the key here to remember is that the Part D penalty, it is not based on your specific Part D plan premium, but instead it is based on the national base beneficiary premium, and this applies to anybody, doesn't matter how much your Part D plan costs. And this national base beneficiary premium, it is announced by Medicare every year. Medicare.gov does a really good job of showing a sample calculation of the Part D penalty, so we will have that example here on the screen in case you want to pause it to give it a little bit more time to understand it. Unlike with the Part B penalty that was based on each 12-month period that you went without proper coverage, you can see here that the Part D penalty, it counts every single month you went without proper Part D creditable coverage for a period of 63 days or more after your Medicare Part D initial enrollment period. It's important to note that because the national base beneficiary premium, it changes every year, the Part D penalty, it can and will fluctuate from year to year. For example, the base beneficiary premium in 2023, it was $32.74. So since it is higher than that now, the Part D penalty has increased from 2023 to 2024. Okay, so we briefly alluded to this earlier, but how can you avoid a potential Part D penalty? It's a really good question. Well, the easiest way to avoid a Part D penalty is to enroll during your initial enrollment period when you first become eligible for Medicare, unless you are covered by prescription coverage that is considered creditable coverage for Part D. Now, having creditable Part D coverage, it allows you to potentially delay prescription drug coverage beyond age 65 without a lifetime penalty. Medicare states that creditable creditable coverage, it simply means that the coverage you have is expected to pay on average as much as the standard Medicare prescription drug coverage. So basically, you are forgoing Medicare prescription drug coverage for other coverage that is as good or better. Although this list does not cover every option, some possible Part D creditable coverage examples, they include employer or union health plans. This also can include COBRA and retiree coverage, or you can have VA health benefits, TRICARE for Life, CHAMP VA, Indian Health Services, and the Federal Employees Health Benefits Program. Again, that is not every option, so we will link to more resources in the description below for other creditable coverage. But regardless of your coverage, if you plan on delaying Medicare prescription coverage beyond when you're first eligible, make sure to check with your insurance plan provider and confirm it in writing that your prescription coverage is in fact creditable for Medicare Part D. Although it is less common, it is possible that your employer group health plan, it could have non-creditable prescription drug coverage. So please do not assume you're good to go without verifying things with them. Also, please be sure to hang on to any creditable coverage notices that you receive from your insurance provider in case you are wrongfully assessed a Part D penalty in the future. For anyone applying for Medicare prescription coverage through Part D or Medicare Advantage after age 65, please pay extra close attention to this. Even if you have properly had creditable coverage, when you go to enroll in Part D coverage after age 65, you may receive a notice from your prescription drug plan or your Medicare Advantage plan, and this is called a declaration of prior prescription drug coverage, which you can see an example of right here. Make sure to complete this form by including the time frame you were covered by Part D creditable coverage, and then send it back to the insurance company. This will help you avoid the hassle of potentially being assessed an incorrect penalty. Now, if you don't complete this form when it's requested, or if you are assessed a Part D penalty, you can request a reconsideration from your plan provider. But if they uphold their decision and they do determine you should have a penalty, your insurance company will notify you in writing that you are receiving a Part D penalty, and they will include a Part D late enrollment penalty reconsideration request form. Again, if you have had creditable coverage and you feel you are being wrongly assessed a penalty, you should complete this form, except now it is sent to a Medicare contracted independent review entity. Currently, this company is called C2C Innovative Solutions. Typically, you will have 60 days from the date on the letter saying you're being charged a penalty to submit this reconsideration request form. According to Part D appeals data from Medicare, in the first quarter of 2023, there were 17,481 reconsideration requests to the independent review entity. Of that total number, 6,922 were fully or partially overturned, which is roughly 40% of requests. So it's certainly worth giving it a shot. However, of course, this appeals process, it only works if you truly had creditable coverage or another valid reason the Part D penalty should not apply to you. If you were simply unaware of the penalty, or if you intentionally did not enroll in Part D coverage due to not taking prescriptions, that is not going to be a legitimate reason for appealing the Part D penalty. Also, there are now very low-cost Medicare Part D plans available on the market, so even if you don't think you need Part D coverage, we certainly still recommend enrolling in one of those plans. Secondly, if you are not able to eliminate your Part D penalty through this appeals process, you should take time to see if you qualify for extra help. Extra Help is also known as the Low Income Subsidy Program, and according to Social Security, this is a federal program and it helps people with limited income and resources lower or cut Part D costs. If you do qualify for Extra Help, you don't have to pay the Part D late enrollment penalty. Here on the screen, you can see general guidelines for income and resource requirements to qualify for Extra Help, but if you think you are at all close to qualifying, we highly recommend you fill out the simple online application for Extra Help at ssa.gov to get an official decision. This even applies if you don't have a Part D penalty, since Extra Help is a great way to save on prescription costs. Now, last but not least, if you are eligible for Medicare under age 65, again, typically due to having disability, once you do turn 65, if you have been paying a Part D penalty, it will be eliminated when you turn 65, just like with the Part B penalty, and you will get a fresh start just like anyone else turning 65, becoming eligible for Medicare for the first time. Ultimately, if you are assessed a Medicare penalty and you do in fact have to pay it, it is very important that you pay these penalties along with your other normal Medicare premiums. Medicare penalties, they are considered part of your Medicare coverage. So if you refuse to pay the penalty portion of your coverage, just know your coverage can and likely will be terminated. You will find it's much better to pay the penalty versus having no coverage and a lapse in coverage, being stuck with nothing. At the end of the day, there are many ways to avoid or eliminate the various Medicare penalties, but like always, there are more details that we cannot possibly cover in one video, so if you have specific questions, make sure to comment below. And don't forget to watch the video that YouTube recommends for you next.
Done.